Well, New York City has been called one of the biggest melting pots in the United States, but is that reflected in our local medical field? I took a look at why some groups may not have someone they can relate to on a cultural level when they're getting health care, and why that might be. Atia Kalair is a Brooklyn College junior well on her way to saving lives.
My journey to discovering that I wanted to be a doctor started since I was a kid. My mother and my father are immigrants from Pakistan, and my mother does not speak English.
It's been said that there are more than 600 languages spoken in New York City. And when it comes to who we choose for our doctors, and more importantly, who we trust, it often varies from one culture to the next.
We know that patients have better outcomes when they see physicians who look like them, who speak their languages.
According to some statistics, less than 6% of physicians in the United States are Hispanic, about 5% are Black, and 4.5% of doctors in the U.S. are of Middle Eastern backgrounds. Historically, students from these groups just don't see a pathway to medical school. Most medical students are in the upper tiers of income and affluence.
And that makes the medical body very narrow in terms of experience and knowledge of the patients they serve. In New York, this is particularly important because the city is very diverse in terms of population. So it's important also the medical body reflects this diversity.
The Associated Medical Schools of New York and Mount Sinai Hospital have a program called Aim High that matches students of diverse backgrounds with mentors for 8 weeks. They work in a lab, do research, collect tissue samples, and they meet diverse doctors, shadow them, and learn about things like imposter syndrome and resilience as a person of color.
I think I really learned a lot, and not just about research, also about how to better communicate with people, how to make meaningful connections.
For Atia, it all goes back to translating for her mother when she was a little girl.
It just sort of hit me that there are so many other people that need this. At the end of the day, what I do know is that I want to be the kind of doctor that is there for my patients, someone that the patients trust and see as one of their own, and someone that advocates for their patient no matter the situation.
So we know Tia is going to be a wonderful doctor,
Absolutely.
right? That we know for sure. And it's an important program, and we talk about this and how culturally it's the outcome is better. And you heard this lady say it in the beginning, when you know that somebody identifies with you. And here in New York City, Mayor Adams is focusing on maternal health because the outcomes for Black pregnant women and Hispanic pregnant women are just not as good very often as white women. So they need to figure out why that is.
Absolutely. All right. And we want you know, as you say, you want doctors who understand where you're coming from.
Absolutely.
All right.
Absolutely.
Let's check in with